Dignitaries from across Africa plan to be in Washington this weekend for a summit, but they carry with them fears about the growing Ebola crisis back home. Marcy Gonzalez takes a closer look at the virus's impact and what's being done to keep it from spreading.
It is the worst Ebola outbreak in history. More than 1,000 cases reported in Guinea, Liberia, and Sierra Leone. More than 700 people killed.
If we don't fight it and contain it there, we will be fighting it and trying to contain it in other places.
Serious steps are now being taken to keep the deadly virus from spreading. Doctors checking passengers at airports before they can board flights leaving affected countries. One emergency room in Charlotte closed yesterday until doctors cleared a patient who had recently returned from West Africa. So far, there have been no reports of the Ebola virus in the U.S., but some doctors fear it could happen.
I would not be surprised if we see isolated cases arrive here, because you can have no symptoms for 3 weeks after you've been infected, but those cases would not spread it around the country. We have good hospitals and good infection control.
Ebola is not spread through the air, only through close contact, as was the case with 2 American missionary healthcare workers infected in Liberia, Dr. Kent Brantley and Nancy Wrightball. Both are still there being treated, their conditions improving.
She was trying to recover and still feeling the effects of the virus.
But at least one family here in the U.S. is feeling the heartbreaking effects of the deadly virus that has no vaccine and no cure.
I have 3 girls who will never get to know their father.
Patrick Sawyer was supposed to travel to Minnesota to visit those daughters next month, but died in Nigeria shortly after contracting Ebola in Liberia. And now the Peace Corps is pulling its 340 volunteers out of the 3 affected West African countries, and 2 of its volunteers are quarantined as a precaution. Marcy Gonzalez, ABC News, New York.